Grabe. Mamaya na lang.
7 vectors. Gusto mo tawag ito full package.
Don't forget inhalation, exhalation is. Teka. Wala ka pang monitor segment. Anong gusto mo?
Nahanap ko nga eh.
Generalize ka muna. Pwede mo generalize muna, tapos tingnan mo kung anong somatic dysfunction mo tira.
Ano? Okay.
Generalize mo muna yung vectors. You're looking for the summation into forward bending, backward bending, side bending left versus right, translation forward and backward, translation left versus right. And then inhalation or exhalation phase cycle.
Lessons mo sa LaSalle. Yung lesson mo sa LaSalle.
Yes, the LaSalle series. And again, going back to Sir Rayson's lecture, you're basically decreasing the afferents, so that turns off the gamma efferents. Blah blah blah. Here we're incorporating
compression.
Abdominal vertex support.
Compression. Inhale. Exhale. Exhale.
When in doubt, you don't. When there's pain involved, when in doubt, you follow what the patient says is least painful, okay, and not what you feel. When there's too much pain there, because you don't want to engage pain. Pain turns things on.
Tama lang may pag-engage ko ng barrier o kulang?
May konting kulang, pero is naman kita.
Konting push pa.
So rotations. Rotations na.
Okay.
Ito na eh.
Active feet, right?
Meow meow.
Ito.
Yan.
Okay na?
Nagagawin siya.
Gagawin mo na? Ma-enjoy mo muna yung moment na.
Ease ka.
Inhale.
Eases. Okay.
Exhale. Gamit pa.
Guys, if you know how to stack all the eases to a certain segment, you also therefore know the reverse, which is stacking all the segments in restriction. And that's the prime position for thrust. Yes, you can localize. And that becomes your pre-prime position for thrust.
And immediately.
And everything else, yes. But yeah, incidentally, it's also positioning for HVLA or MLVLA.
Okay.
You good? Nasaan cycle ka? East ba yan? East?
Kanina?
Anong ginagawa mo yan? Spaceman unwind. What are you doing?
Focal na induction?
Okay. Sige. Structural induction. Kids, what Rayson's looking for, if he has a finger at the monitor point, that he was looking for focal induction. Structural induction is basically you have your finger there and you're waiting for a give and you're following whichever give the tissues give into. So if it goes right, you go right, and then if it allows you, push deeper. Okay, and then you're just waiting for the tissues to all collapse around you, because if you do it right, the tissues will. The closest work I've ever seen to structural induction techniques would be matrix repatterning. What's that? Roth. Yeah, Roth. Them guys.
Pwede naman isabay sa space lang yun.
Yes, pwede sabay sa spaceman and one. What we call a spaceman unwind is basically you're holding the head off table, and then you're following whichever movements the head gives you. Okay? So if the head's flexing, you follow into flexion or extension, and then you combine all of the movements. But it's not you directing, you're just following what the body likes. Okay? So it's a positional release following a therapeutic pulse. Following what the body is telling you to do. But it's a dynamic thing.
Okay.